Welcome to Adapting Class. If you are trying to memorize psych medication for the NCLEX, you are going to get overwhelmed. Instead, I'm going to walk you through a psych unit, patient by patient, and I will show you exactly how to recognize medication instantly and what this patient need. By the end of this video, you will stop guessing and start answering psych medication question on the NCLEX confidently. So stick around, watch the way I'm going to approach it. You're not going to memorize psych, but you will know them. How are we going to do this? We're going to walk through the hallway. I'm going to give you a scenario, and then we'll figure out what is going on. And you're on a psych ward after change of shift. You're walking through your hallway. You went to your first room. Your first patient says, I feel what? What is the patient telling you? I feel hopeless. I have no energy. And what? I can't sleep. And you check the medication available. What do you see? Sertraline. You see Fluoxetine. What do you think? You pause and say, wow, these are the medication this patient is taking. What are those for? You know that something came to you and said, this is SSRI. I know this medication. And you ask yourself, what is the NCLEX going to ask me about this medication? Oh, they are the first line to use for what? Depression in this patient. So this is antidepressant. Well, you tell the patient it's going to take 2 weeks to work. Really? No. You tell the patient, it may take some time to work, sometimes 4 weeks for it to, and you tell the patient, it may take some time to work, sometimes 4 weeks to work, but 2 weeks, I need to see you. Within 2 weeks, I need to see you back for examination. The provider will see you because of what? Suicidal ideation. He said, okay, what should I worry about? Well, sexual dysfunction. So don't freak out when you have libido. Your sexual drive decreases. That's acceptable. And then the patient said, what should be the last thing I should worry about when taking this medication? He said, oh, when you're sweating, when you have diarrhea, when you have cluness, and your temperature goes up, go to the emergency room because you have what? Serotonin syndrome. That's what the patient is worried about. Serotonin syndrome. This is what you tell the patient. You need to do that. If you see sweating, diarrhea, cluness, increase in temperature, go to the emergency room. And when you get there, they're going to take care of you because this is deadly. And the patient said, thank you. But before you left, you said, oh, in order to complete everything, I want you to know there's other medication the doctor will give you. Paroxetine. It has the same function as the one like the Fluoxetine. There's other group, though, Citalopram and Citalopram. These people causes QT prolongation. So watch for them. They are antidepressant SSRI, but the Lopram, Citalopram causes QT prolongation. That's your first room. Depression, SSRI, and you manage that patient. How did you do? I know you master it. The next patient, the second room you went, the patient said, I have chronic pain. And also I have depression. Fix me, like fibromyalgia. I have fibromyalgia, but I have chronic pain and depression. So fix me. And you look into your book, you say, what would the doctor give this patient? Which medication? Depression and pain. Duloxetine. I don't want you to forget. This medication is specific, is SNRI. They have serotonin and then norepinephrine inhibitors. They elevate this level, so you have to be careful. They use for pain and mood, Duloxetine. And therefore, what should I worry about? Because of norepinephrine and that, then you know that, oh, this patient is going to have hypertension as a risk factor. and they're going to have withdrawal symptoms. So you cannot just stop this medication as much as possible. That's your room 2. Now, in the third room, you went to, the patient still has depression, but what, he's taking some medication and he has what? Dry mouth. He said what? Constipation. He has urinary retention. What do you think? What do you think is going on with this patient? And then you went back and said, I see something like I'm dancing. What is that? The patient has dermatitis. He has some anticholinergic side effect. And he said, what? He has neuro, he's confused. And then what? Cardiac arrhythmia. I said, oh, on the monitor, that's what you see. He said, oh, I need to evaluate this. And that is what is dance. Dermatitis, anticholinergic effect, neurological problem, cardiac arrhythmia. I'm doing the dance. And these symptoms, dry mouth, constipation, and urinary retention, consistent with what? Anticholinergic effect. Therefore, this patient probably is taking TCA, Tricyclic antidepressant. And you look, you say, of course, the patient is prescribed what? Amitriptyline. And you say, oh, there's another medication that's the same thing. What is that? Naltrexone. So don't forget about them. These are TCA. These are their major side effects. Very, very important. There's another group of medication. It's another medication the doctor can give it to you. If you don't like amitriptyline or no amitriptyline, then there is imipramine or imipramine that we can give it to you. So when you see these medications, they still what? TCA. Very, very, very important. How are you feeling? You high five yourself and say, oh, let me just go to the room 4 because I think I got it now. I'm on the roll. Room 4, when you were there, the patient said, I just can't sleep. I can't sleep. You said, oh, I know we have a bunch of medication we'll give you. We can give you Trazodone, or we can give you Zolpidem, or we can give you this medication, Methadone, right? All these medication make you sleep. And you said, well, you got to be careful, okay? Methadone will increase your appetite, so you're going to eat. So if you can't eat, it will let you eat. And you said, look, you're a male. If you're taking Trazodone, you have to be careful. You can have sustained erection. And if it happens for more than 2, 3, 4 hours, I need to go to the emergency room. This is what we call pravism. And that happens, that's emergency. Let me know. But these medication, you can take it to sleep. But because you're a male, if you have sustained erection, then I have to worry about it. What are you going to worry about? They are sleeping medication. So what is the problem? 4 risks. You got to pay attention to it. Sleeping, walking. They can be sleeping, walking. So you got to monitor them. Make sure you give this medication at night so that they don't fall. All these things, very, very important because it causes sleeping in these patients. If they have insomnia, you can give it to them. That's what this patient is complaining about. And then room 5, the patient said, I have depression. Fine. But I don't want no sexual dysfunction. Absolutely no. And what is the problem? I'm smoking. I can't stop smoking. I don't want sexual dysfunction and I have depression. Please fix me. And he said, oh, I know what to do. I think the doctor is going to give you bupropion. This medication is very good. It helps with smoking cessation. And then he has no sexual dysfunction. So it's a very, very good choice. But I have to make sure whether you have head injury before, otherwise you're going to have seizures. If you're a young patient, you're going to have seizures. And therefore, I need to pay attention and we got to check and make sure you don't meet any of these criteria. Now, you were happy and you said, there's one more room I need to go to. You went to the room, the patient said, I'm craving for I'm craving for pepperoni. And you said, why you can't eat it? They said, I cannot eat it. They said, I need smoked fish. They said, I can't eat it. Even red wine. They said, no, I can't eat it. Aged cheese. Why I can't eat it? I'm worried. I need something. These are all things I used to love. All of a sudden, they say I can't eat it because I'm taking some medication for depression. I said, oh, I know. You're taking what? MAOIs. Why? If you do that, these are the things that hate tyranny. If he does it, you're going to have hypertensive agency. And he said, oh, that's why. And you look at the medication, of course, the patient may be prescribed Sertraline, maybe to prescribe Phenarxine, maybe prescribe what? Isocarbazine. And he said, oh, the last one is very complicated. This medication has like crazy names. What is that? And this is what you have. These are all antidepressant. They're different. They are MOIs. They are thiamine derivative. And therefore, you should stay away from it. That's why you're craving for pepperoni. You can't have it. You can't eat some smoked fish. You can't have red wine, aged cheese, all those things. Very, very important. We don't want you to get sick. He said, thank you very much. I love it. And then you say, oh, this was hard, but you say you went to the other room, room 7. This guy is what? He said you can see Jesus on the wall. And he said, what? There is no Jesus on the wall. Say, yeah, I can see something crawling on my skin. And you know this patient is hallucinating. And he has like disorganized thought process. Whenever you say, he just repeated echolalia, right? He said, that's a schizophrenic patient. What would I do? What medication? Psychosis. What medication? We got to use antipsychotic. And he said, he's agitated. He's screaming everywhere. The first medication that come to your mind is first generation antipsychotic. I'm going to give you allopurinol. And the doctor said, yeah, I agree. We should give it to them. And you inject to the patient. Boom, allopurinol. And the patient calmed down. Later on, you went and checked on the patient. What is the patient? He has muscle spasm. And you said, oh, what is going on? This is what we call acute dystonia. And he said, what medication would I give them? Benzodiazepine. Boom, you take care of it. And he said, well, we don't have benzodiazepine. What do we have? You can give them diphenhydramine, right? This Benadryl. You can use it to treat it. And he said, all this is what? Extrapyramidal symptoms. Then the patient said, after you treat it, he said, I have inner feeling of restlessness. And you say, well, this is what? Akathisia. So, oh, you know all these things. This is like taking care of the patient. And the patient started doing what? Lip smacking the lip. You know, the patient have tardive dyskinesia. All of this is what? Extrapyramidal symptoms. And this is all antipsychotic. But then, as soon as you guys left the room, you check the monitor, the patient like tachycardic. You went in, his temperature is very high. It's diaphoretic. And what? He has muscle rigidity now. He has autonomic dysfunction. This is what? What do you think? This is NMS. It's a neuroleptic malignant syndrome. What do you do? We went take this patient down to the ICU, monitor them before they get sick, and you give them what? What do you think? Bromocriptine. You got to take care of it and then manage this patient because of that. How are you doing? Very, very important concept. These are antipsychotic and what you need to know. And then the doctor said, well, I asked you, what other first generation we could have used? So, yeah, flumethazine. It's his friend. It's the same thing. Or this medication, chlorpromazine. This is all old medications, right? We can use them. So these are other types of first generation antipsychotic. Everybody said, oh, we cure this patient as much as possible. But the doctor said, well, there's some other medication with less side effect. No, NMS or EPS is very weak. They don't get it. The side effect is very profile is very low, so we can use them. And you say, yeah, I know them. Some of them last name ends with what? Zappings, the pins, right? Say zappings. Say, oh, yeah. There's one that if you're on it, I need to worry about it. And which is one? I got to check your WBC because it causes agranulocytosis. Say, oh, really? What is agranulocytosis? Yeah, your WBC go down. So we got to monitor your WBC. Therefore, if you have low-grade fever or you have runny nose, you're taking this medication I need to worry about. And what is that? Clozapine. So, oh, yes. But then I know there's a zapping. Also, he has olanzapine. What should I worry about? This guy is just weight gain problem. So, okay, that's good. Now, more second generation antipsychotic. He said there's a quiet one among them. Quetiapine. What is this major problem? Mostly sedation, very sedative. And he said, okay, I know another acinapine. This medication causes hypertension. But this is the only thing we have, the pins? He said, no, there's dones too. Ziprasidone. And what does this causes? QT prolongation. So watch it. But don't forget, it also causes agranulocytosis, like the clozapine. And the last one is risperidone. This is the first done you can have, but this guy can cause gynecomastia, big breast in a male. You can have hyperlipidemia, diabetes, and weight gain. So these are all antipsychotics that you have to be very confident to be able to know them. They are NCLEX will test you on them, and so be careful. Now, and you said, well, all these things are side effects. Is there anyone that doesn't have? It's a third generation, but we still call it second generation. It's called Reprazole. And this one, less side effect, less weight gain, everything. But the most common is akathisia. So watch for that. It's very, very good, causing akathisia. And that's your room. You're taking care of that room. Now, this patient, the next room you were, room 9, he has depression, but he can't stay still. He can't stay still. He's walking around, he's talking nonstop. He has pressure speech. And he will never stop talking. He's moving from one topic to another. And he's cleaning his room nonstop. This is a bipolar patient because he has mood disorder. Therefore, what are you going to give this medication? Say, oh, lithium, I know. And they say, yeah, NCLEX will ask you. He has narrow therapeutic index, narrow therapeutic index, a bunch of side effects. But what should I worry about? GI symptoms, number 1. GI symptoms, number 1. If they have nausea, vomit, diarrhea, I should worry about it. What else do I need to know? Make sure your sodium is normal. Don't increase it. Drink about 2 to 3 liters of water a day. Very, very important. Very, very important. Avoid NSAID because it affects your liver. Any medication that avoid NSAID because it affects your kidney. Any medication that affects your kidney, you should avoid it. And this is a very common and question. Lithium, make sure sodium is normal. They're drinking, they're avoiding anything that affects the kidney. And therefore, number 1, signs and symptoms, prioritization is the GI symptoms, dehydration. So, okay, Sometimes we can use other medication, valproic acid, right? Anti-epileptic. Or we can use carbamazepine. Or we have phenytoin. There's other medication we can use, right? These are all anti-epileptics that we can use for bipolar, but the most common is the lithium. I just need to know a few things about this in case they ask me, I can take care of it. Valproic acid, worry about what? Pancytopenia, your platelets go down. They are all sulfur drug, so they can have Stevie-Johnson syndrome. Carbamazepine, the one thing you're supposed to know is basically can be used in trigeminal neuralgia, and then you can use for neuropathic pain. Phenytoin, you should avoid protein because it can cause absorption is affected. At the same time, you can have gingival hyperplasia. You have to do oral care and antibiotic. But number one, treatment for bipolar is mostly lithium. If you don't have it, you can pick any of this to treat it. Now, let's get to the anxiety, folks. This patient is very anxious. He can't stay still. He's like worried about everything. You say, oh, you need anxiolytic. I need something that can act fast. And he say, oh, I got to pick something that has PAM at the end, right? Lorazepam, alprazolam, right? These are PAM and the LAMs. These are fast-acting anxiolytic. They are dependent. And you can have withdrawal symptoms associated with it too. So you cannot just stop it just like that. You got to be careful. And then it's fast acting. So they are what we call benzos. Benzos. The major side effect is sedation. And therefore, respiratory depression is big. If you are pregnant, you cannot take it. No pregnancy. And you cannot take any downers like alcohol. You should not do that. So why? Why is all these good medication that act fast? I can be dependent on it. If I withdraw, I'm in trouble. I can have seizures. And then if I'm pregnant, I can't take it. And it can affect my respiratory status. They said, is there any other choice? You say, yeah, there's choices, but you have to wait for a couple of weeks, 2 to 3 weeks. I say, oh, fine, I'll take it. And what is that? The bus, Buprenorphine. Okay, I will take the bus. That means I can take it, no sedation. So I don't have to worry about it. I don't need to take it in the evening. I'll take it anytime I want. There's no dependent issue. You say, oh, okay, but it takes some time, like 3 weeks, 2 to 3 weeks for it to work, sometimes 4 weeks. I say, fine, I have time. There's no need to worry. I'll take Buprenorphine for that. No dependent. I'd rather do it. And then in the next room you went, you said, this kid, what is his problem? He can't pay attention. He has deficit related to that. He's hyperactive. So, oh, this is what? ADHD. What can we do? Give them a stimulant to calm them down. What option do I have? What option do I have as a stimulant? You say, okay, there's a Methylphenidate group, right? And then there is the amphetamine group, right? These are also, in case you see them, just look at the name amphetamine. These are stimulant. And then there's the non-stimulant. The non-stimulant, I want you to know this one, Amitriptyline. Non-stimulant is non-stimulant, but it does the same job, right? There's a major side effect associated with this medication. What is that? It's going to lead to what? Decreased appetite. In the process, height and weight issue. So you have to monitor the kids' height and weight. Very, very important. Height and weight. And so in these kids, growth is very important to check whether they're growing. Of course, because it's a stimulant, you're going to have hypertension, you're going to have tachycardia, you can have all the signs and symptoms, and insomnia. Therefore, this kid has to take the medication in the morning. But the most important, growth, height, and weight issue because of the appetite suppression associated with this depressant, right? Give it in the morning, otherwise the kid would not sleep. And then he said, now that I know the stimulants, there have to be some substance abuse issue. And you're going through your list. You say, okay, if somebody has opiate overdose, what would I give the patient? Naloxone. Okay, fine. So somebody have what? Benzos, overdose. What would I give them? So, oh, I know this. It's not going to be naloxone anymore. It's what? Flumazenil. It's okay. I got it. Flumazenil. That's what I'll use. I said, if I'm dependent on opiate, what medication I'm going to use? I'm give them long-acting opiate, which is methadone. Or this medication, buprenorphine, is long-acting. So pay attention if you have opiate overdose. How about alcohol? If I take alcohol and I want to stop completely, but I want to make myself sick if I take alcohol, it's what? Oh, disulfiram, alcohol abuse, right? Disulfiram. This will make you sick. Therefore, I call it anti-abuse medication. But if I don't want to sick, I don't want to drink alcohol, but I want to take something that looks like alcohol, then I can give you like a benzo. This medication, very good. Clozapine. This is what you use when you're alcohol dependent and you want to quit. This is what we give you. And you can wean yourself off slowly so that you can stop cold turkey. But if I'm craving, this is different. If I'm craving for alcohol, then I can also take this Naltrexone to help with the craving effect. The chlordiazepoxide is for what? Withdrawal. So to prevent you from withdrawing, we'll give you this as you quit the alcohol. But if you're craving and you can't stand it and you don't want to take the alcohol because you're taking disulfiram, we give you Naltrexone. And what is that? This is very, very important. Before you give to the patient, this medication is like opiate. It binds to opioid receptors. So do a urine test and make sure there's no opioid in their urine. If there's opioid in their urine and you give them Naltrexone, they're going to have what? Withdrawal from the opioid. Therefore, very, very important. You got to check it. And if I want to maintain sobriety, I give you alcoholate. Watch it. Alcohol has so many things you have to pay attention to. And therefore, this will maintain sobriety. How about if I want to stop smoking? We already know bupropion, right? Smoking, we have our bupropion. Now, but there's another medication that will help me. Nickel. This is very, very good. Sanchez. But if you have Stevens-Johnson syndrome before, if you have kidney problem, you cannot take it. These are very, very important information I want you to know because the NCLEX will ask you about them. And in order to ace your test, you have to know these little things. And you walk to your last room, room 13, and the patient you saw, patient has dementia. What would you do? Something that will increase acetylcholine. What medication can do that? You say, Donepezil. Donepezil is very, very good. This is for long-acting situation. But if I want something short-acting, I can give them something like something myasthenia gravis patient would take. Stigmine, rivastigmine. This will increase acetylcholine, but it has a short-acting effect. But if I know they have moderate or severe dementia, then I got to give them something like a patch, like that they don't have to think about taking the medication. It's Memantine. This will support their cognitive function and help them. This is adapting NCLEX pharmacology, psych medication to help you understand all the psych medication you need to know. what the NCLEX will ask you, mental health. There's no medication that you see on psych medication that has been not discussed over here. It may not be the same name, but fall under the same group. You know the concept, use it. Don't memorize it. Apply the knowledge. If this video helped you, subscribe to Adapt NCLEX for more content. And the next video that will show up, I want you to click on it. Practice questions on this. Take care of yourself. Bye.